It's Katie Crysdale here from Lakeview Aquatic Consultants. Welcome back, or welcome if you are new here. So today in this video, I'm going to be talking about how to do a better spinal rescue as a National Lifeguard here in Canada. I want to give you a quick heads up that although I am a National Lifeguard Award holder, I am a National Lifeguard instructor and a National Lifeguard instructor trainer here in Canada. My personal opinions in this video are not endorsed by the Life Saving Society of Canada, any branch, and they should not be taken as any official position by the Life Saving Society. I continue to make these lifeguard videos because I've spoken to so many of you over the years who are looking to practice, study, review, to get more information outside of class because you only have the 40 hours in your original course or you only have the time in your recertification. So I'm endeavoring to share my experience as an instructor, my experience as a guard, and my experience as a facilitator who's done hundreds of hours of in-service at different facilities as a contract instructor to distill learnings that can help you be a better lifeguard. That is the purpose of this video. This weekend, I was working with a client. A rural municipal pool brought me in. We did 8 hours of lifeguard training this weekend. This was their quarterly in-service. Periodically, I'm hired to do an in-service for a pool where they're looking for something different or they're looking to address a specific problem or the pool manager doesn't have any fresh ideas and they want to outsource that to somebody like me to bring in fresh ideas, activities, concepts to address particular concerns. So one of the topics that was raised in our meeting about this in-service that I would be running over 2 days was the client, the aquatic manager, mentioned she wanted to review spinals, both the rolls as well as the boarding. So in this video, I'm going to be sharing some of my comments and feedbacks from this group. I'm not in any way identifying the pool, the people. It was a good sampling of what I normally see the first time I interact with a new group of. They were all certified National Lifeguards. They were all qualified, capable, competent, and working, but there was a range of skill sets. There was people who'd been certified for 2 months only to people who had been working and certified for 5 to 7 years. When you are combining those people together into small groups to practice, you are going to see a variety of things materialize in terms of areas in need of improvement, and that is the purpose of this video. I want to really step by step go through the spinal rescue process. We're going to be using the National Lifeguard Candidate Workbook. I'm not going to be using the award guide in this particular video. This is a simplified list of the must-see items that do come out of the National Lifeguard Award Guide. As a quick reminder, if you haven't watched any of my other National Lifeguard videos, the award guide is the reference manual for every National Lifeguard Instructor, NLI, or National Lifeguard Instructor Trainer, NLIT. This is a publication that may have some small variations branch to branch. So the British Columbia edition may be slightly different from the Ontario edition, but the National Lifeguard program is a national program. Aside from regional variations, the program standard, i.e. the requirement to be able to do a spinal roll, does exist in the program wherever you are in Canada. As a quick sidebar, I'm not going to be discussing the appropriateness or not of continuing with spinal rescues. I know this is an ongoing point of discussion in the medical community at large. Should lifeguards even be doing spinal injury management? Should we even be using spinal boards? That is not something that I have the skill or expertise to be talking about. The purpose of this video is to help those of you for whom you need to be able to effectively demonstrate spinal injury management or a spinal rescue. That's why you're here. Whether you personally think it is important we do them or not, we all need to know how to do them. I also should mention this entire video is focused on the National Lifeguard Pool Standard. I am not qualified in any other stream. So let's have a look at the spinal performance criteria as they are articulated directly in the National Lifeguard Candidate Workbook. If you go to lesson 22, that takes us to management of a spinal injury. I'm going to read the individual steps and add my own commentary in relation to the group I saw this weekend, because I have found that the best videos are in relation to real life circumstances and make it relevant to you for implementation. orientation. We set everyone up into small groups, let them decide who was going to be the victim who had the spinal injury. We let them decide who was going to be guard number 1, guard number 2, guard number 3, and then within their team, they were going to decide who was going to bring the spine board, who was going to call 911, who was going to go get the AED, the blanket, the first aid kit. I'm not going to get that granular. I want to talk more generally about how the dynamics of a spinal rescue work and how you can better improve those dynamics if you are looking to excel in your recertification, at maybe a wet screen for a job, at your original course, or just if you're looking to boost your skills because maybe you work at a pool that doesn't do a lot of ongoing training. The first thing we as National Lifeguard instructors or any assessor is looking for quick recognition that there has been a spinal injury and an immediate response to that. There's a couple things that come into play here. So we want to see some sort of signal. We want to see a whistle blast, a hand signal. The spinal injury is a major. In this video, I'm talking about spinal injuries primarily in the shallow end of a swimming pool. I am also looking for a mechanism of injury. Only things that have a clearly identifiable mechanism of injury should be treated as a spinal. For example, diving into the shallow end, falling off of a ladder, falling out of a tree on land. We're not just calling everything a spinal injury if there is no mechanism of injury. That is both the victim simulating some sort of spinal injury as well as a circumstance or scenario that allows the lifeguard candidate who's being assessed to identify there is some sort of spinal injury. And there also needs to be in that recognition an immediate response in terms of the seriousness. So this is going to be a major injury. This is going to be perhaps a pool clear. The second item we're going to want to see in terms of must-sees associated with a shallow water spinal are going to be an appropriate entry. There are going to be different opinions as to what is an appropriate entry, but we do want to balance the expeditiousness, getting to the victim promptly and move slowly. The water is going to move. The victim is going to move. We can't just inch along in the water. We do still need to get there in a timely fashion, especially if they are face down and there is concern they're not going to be able to lift their head and breathe. So after your quick recognition and your immediate response, which includes some sort of signaling, after your appropriate entry, which can include a slip into the pool, wading into the pool, running into the pool, a basic dive, it's going to depend on the environment. I can't capture every possible aquatic environment in this video. Then we are looking to see a smooth rollover. And this is the main place where I want to spend some time talking about the challenges that I saw with the group I was working with this weekend. I continue to see out in the world, both training, recertifying, and working with different lifeguards across Alberta, that there is not a diversity of skill set when it comes to our spinal roles in the water. So quick reminder that in the Life Saving Society program, there are 3 types of spinal roles taught for different environments. Each guard can have their own preference, what works best for their skill set, their size, their aquatic environment. However, lifeguards should be taught 3 different types of roles, and that's not always happening. We need to be teaching or taught the vice grip. Vice grip where I'm gripping onto the face, on the cheekbones. I have my forearm down the middle of my sternum on the front side, and then on the back, I've got the hand on the head. The arm is down the spine, and I'm squeezing through the front and back. That is going to be the vice roll. Very, very important that we landmark, we grip, we squeeze before we roll them over in a corkscrew fashion. We are not looking for a pancake. We want a corkscrew or torpedo for a smooth vice roll. We are going underneath the victim when we are rolling them. We are not lifting the victim up over us. I recognize that a talking head video is not the best way to learn spinals, but I really wanted to capture some of my thoughts. In brief, we need to know our vice rolls. We also need to know our modified. For some reason, people are not teaching the modified roll. This does exist in the Canadian Life Saving Manual. This is something that you should learn to do. I describe this as the forklift. So we're taking our robot arms and we are forklifting up into the armpits of the victim in a way that we can then thread up and squeeze on the side of the head and have our elbows down on the rib cage and we are using this to then roll them on top of us. Not a great option for spinal boarding, but it is an approved rollover technique for spinal injury management currently 2025 in the Life Saving Society National Lifeguard Pool Program. The third type of technique is the Canadian or the reverse Canadian or the log roll technique. That is where the victim's arms are extended and then they're squeezed through the head and they are basically rolled over so that they are face up. And the rescuer, the lifeguard, has control of the victim through their forearms, on their arms or away from them. In this video, I'm not able to cover every aspect of every roll, but I did want to say that we as a group, we definitely had to spend 20 minutes practicing our rolls because people are not practicing their rolls on the job after certification. They are just assuming I did it in my class, I did it in my research. You need to practice your rolls in order to be successful. You don't need 10,000 hours of practice, but you do need to practice a lot more than people are doing. Doesn't take a lot of time. After 20 minutes, I would say it was a very steep curve in terms of the quality of rolls that we were seeing, but there was a lot of this pancake flipping. There was a lot of lack of certainty where to landmark in the vice grip. As I say, for women, it's always in the valley between the mountains. It's straight up and down the sternum, straight up and down the spine. If there is a ponytail at play, we need to do some Spock hands. We need to get the hands high enough to push. We're not grabbing the neck. We're not grabbing the nose. We're grabbing basically the chin, the mouth. Those are the details we need to practice because in a recertification or in service, we need to see competency. Getting back to the must-see items for a shallow water spinal, after that smooth rollover, because we're assuming that they're face down in shallow water, but maybe you're lucky and they're not face down, or maybe you're unlucky and they're in deep water, we need to make sure that we're seeing a mobilization of the spine during the rollover. That is a big one. We don't want to see the hip sway. We don't want to see the pancake. We want to see the corkscrew or the torpedo. That requires practice. And then if you're working at a deep water facility, like I worked at my first job, we had a 3-meter deep pool. It was a 50-meter pool. You need to master your life-saving kicks, egg beater, scissor kick, whip kick, whatever that looks like, so you can do all of this in deep water without touching. That's a whole other kettle of fish that requires extra practice and extra training if you're going to work at that type of facility. It also comes down to height. So I'm 5'10", and this particular pool we were working at this weekend was a shallow end of 1.2 meters. For my Americans, I'm almost 6 feet, and the pool was basically 3.5 to 4 feet. I am then crouching down and doing kind of a limbo, going under to lean back and hold my victim. That requires practice so that I don't slip. I need to figure out how to corkscrew them and not drop them or not push them up out of the water and over me. All of that requires practice and workshopping. To the credit of this facility, they did it on the job in the in-service training. We had plenty of time allocated, but I know lots of aquatic facilities, it is that expectation that you work through practicing that on your own time so that you're ready to go in an emergency or an in-service scenario. The next couple must-see items that were issues this weekend was EMS activated at the earliest possible moment, but without a why. Almost every participant said, call 911. And that was it. Why are we calling 911? You need to give that communication to your bystander, to your secondary guard, to whomever, to complete the message being given to 911. Why are we calling 911? I have a spinal injury in the shallow end of the pool. I have an unconscious male in the deep end of the pool. I have someone who fell off of a ladder and they're not breathing. There needs to be a why, like social studies. Who, what, where, when, why, how. If that information is not conveyed to emergency management, they are not going to appropriately triage and dispatch a crew to come out and help you. It's not just about the AED and the first aid kit and the blanket. The 911 has to be called and effectively. I've talked about this in my scenario video for the National Lifeguard course, how to make your scenarios better. You need to be clear in your communication. It's not just a checklist of do this, do this, do this. There has to be a why and there has to be a purpose to what you're doing. From there, the next bullet point on the must-sees for management of a spinal injury in the National Lifeguard Pool Program is the victim stabilization stabilized with a spine board or other appropriate device. This is a big one. I see so many NLIs, National Lifeguard instructors, or aquatic facility staff. They obsess, absolutely obsess over strapping order or spinal board type or focal point, or whether you are slant boarding or knife boarding. Are you using a tube? Are you not? Respectfully, the Life Saving Society does not care what equipment you use or how you use it, as long as you use it safely. So these rants I see on the internet about how it's chest, hips, head, or how it's hips, head, or chest, the Life Saving Society does not care. The manufacturer does not care. It is a tool. You need to come up with your own strategies on the job. You need to train and create procedures for your guards. And that needs to happen as well at a small level in your National Lifeguard original course. But we do not need to create lifeguard candidates or staff who are so paranoid about the order of strapping that they can't expeditiously do the rescue because they're so paranoid about doing something exactly. We need to not micromanage our guards. We need to teach them independence, and we need to teach them good decision-making skills. If there is a reason to do hips before chest, maybe somebody has a bigger lower body or a smaller upper body, or as long as there is a reason, for me as a National Lifeguard instructor, if you can give me a why, if you can give me a reason as to what you did, that is 99% of the law in force. If there is no reason, then you might be on your own. But I really, really get frustrated when I see people insisting, well, you have to slant board, or you have to jackknife, or you have to use a focal point in the shallow end, or you have to do this with the gutter, or you have to use a beaver tail. The Life Saving Society doesn't care. It does not say that in the must-see items. If you want to say that your workplace or your occupational requirements are XYZ, that's perfectly fine, but don't muddy the water for National Lifeguard candidates or people at a recertification by saying there's things when there aren't. And I get that all the time on these videos. People comment and say, well, you didn't do this, that's required. Show me in the must-sees or the award guide where it's required. It's not. I know that document back and front. It's not. It may change, but as of 2025, it's not in my branch's materials. All of that to say, I saw the same thing happening when we were practicing spinal boarding. There were some really strong opinions and personalities of the staff who were working together about focal points, about strap order, leadership, which guard is in charge of the board, which guard is in charge of strapping, which guard is in charge of boarding. That was appropriate because we were doing on the job in service for a team of guards who should know their workplace procedures. I take a step back and I take their direction, how they do things at their facility, because I'm just visiting. But in a class that I'm teaching or facilitating for general participants, we don't get in the weeds so much. But I would say that communication is a big one that comes up, and building that communication and not making assumptions about who's done what. Because there were several scenarios we debriefed where somebody said, well, I called 911, and somebody else said, I got the AED, but nobody got the first aid kit. Or there were gaps in communication and then gaps in procedures of what needed to happen. The other thing I want you to keep in mind is spinal boarding has changed over the last 10 years, where we're now really clear about spinal boarding only being done when the victim has vital signs. So if the victim is vital signs absent, VSA, we are not going to be taking the time to strap them on a spinal board because it's life over limb. They need CPR, they need defibrillation, they need an AED. We're not going to worry about a spinal injury. We're going to remove them from the pool and focus on compressions. It's also very important when you're doing your spinal roll that you're doing an assessment of ABCs, if that's possible out in the pool. Your look, listening, and feeling for signs of breathing. If you're doing a vice roll, if you can feel the breath or you can't feel the breath, you may not be able to identify right in the middle of the pool exactly what's happening, but you should be assessing early on what is the type of rescue that we're doing. Is it a conscious or an unconscious spinal scenario? Is it shallow or deep? Are you one guard or are you a group of guards? Is it a big pool or a small pool? There's a lot of factors that go into the individualized scenarios and situations that you may be practicing at your facility. Big note on the must-sees, stabilization on a spine board is not required if CPR is indicated. That's a big one. Do not spine board somebody who needs CPR because it takes too long. It's not expeditious. You will sometimes hear the counter arguments, well, if you could do it quickly and it's the best way to get someone out of the pool. I don't want to go down that rabbit trail of what if, what if, what if. I want to see you making a good decision in the moment. Last couple of must-sees here for our management of a spinal injured victim. There needs to be a victim reassessment of ABCs and CPR if required on the pool deck. As soon as the victim has been strapped on the spine board and they've been safely removed from the pool, then we are going to either tighten the straps or move them away from the edge and start our compressions on the backboard if something changes, if their state deteriorates. We're assuming we're getting them out on the spine board and continuing with basic victim care. They are conscious, we're getting them a blanket, asking them questions in order to be able to fill out our incident report form. We're waiting for EMS, starting our secondary survey, starting our sample questions, other signs and symptoms, allergies, medications, last meal. All of those things are happening because the person is conscious and we can't treat the medical injury. If they are unconscious, pulseless, we are doing CPR with an AED. It's a completely divergent treatment. So that is an important split. However, it also does require things like effective use of barrier devices, effective direction for backup lifeguards and bystanders. We're now typically talking about more than one guard, more than two guards, more than three guards. There may be an aquatic supervisor, a bystander, a dry facilities person, or a swim coach, or a cleaner, or attendant, or other program staff. How are we going to direct those people for crowd control to get us more information? Does anyone know this victim? So that communication piece is something I definitely wanted to highlight in terms of how you can do your spinal scenarios better, because I consistently see poor communication, not just with the group I had this weekend, but with every group who is more focused on the hard skills of spinal rescues at the expense of practicing soft skills like communication, like victim care. There also is the need to be able to deal with complications and treatments as required. So what are you going to do if your victim vomits? How are you going to support the victim in flipping the spine board? I am not personally a fan, nor do I teach or recommend having people's hands shoved into or strapped down on a spine board. That is absolutely terrifying. Now, I know the counter argument is we don't want to squash anyone's hands if we have to tilt the spine board because they're vomiting. It is up to you to stay with your victim to be able to address vomiting if there is that complication. You don't just leave them on the spine board and wander away and grab a coffee. They may have difficulty breathing if they have a spinal injury and they're on the spine board in a position that makes it difficult to breathe. Or maybe there's some other injury like a broken leg or a broken arm that wasn't initially visible while they were in the water, but now is starting to swell and cause them pain or difficulty breathing. So we are constantly reassessing and staying with our victim and talking to our victim. This is one of the topics I'm hoping to make a video about here shortly, is those conversations with our victims in terms of how to make small talk, to be inviting and welcoming and get the information we need. That bedside manner we think of from nurses and doctors. Rest and reassurance is a huge component of mitigating shock and keeping something from spiraling to a worse emergency. If you have extra bodies around to be able to delegate a head to toe survey, to look for medical alert bracelets or ask questions of the victim or their friends or family, that's great, but that doesn't always happen. Don't forget that if there are any other injuries or medical conditions, we would refer to the appendix of the National Lifeguard Award Guide to go to the specific first aid treatment for those other items. But typically in a spinal situation, the spinal is going to take precedence. We're always typically treating for shock, or we may be treating a bleed or something like that. But generally, the spinal is the major injury, and that is why it's a standalone assessed item in the National Lifeguard Pool course. It is a standalone lesson. We spend several hours talking about and practicing spinal injuries. It is a mandatory item in terms of examination or passing the National Lifeguard course, and it is also an item that is included on recertifications. So it is definitely a skill that lifeguards should have, even though, knock on wood, hopefully it's not something you actually ever have to respond to. In my personal experience, The closest thing to a spinal injury I ever responded to was a trampoline injury when I worked at a recreation center with a gymnasium for gymnastics. But I do know people who work at water parks and wave pools and other types of facilities may be dealing with spinal injuries more often than I have in my career. And so that's what I said at the beginning of the video. I'm not here to comment on the appropriateness of continuing or not continuing to treat spinal injuries with spinal boarding, with cervical collars. That is something for the larger medical community to address over the next 15 to 20 years. There definitely have been shifts how these spinal injuries are treated and what the science is saying. But as of right now, it is still a mandatory component of the program and something that you need to be skilled at in order to be able to be successful in a National Lifeguard Original course, National Lifeguard recertification, or your aquatic staff in service. The last must see is preparation for transport and safe removal from the water when possible. It is possible to keep somebody in the pool on the spine board and support them. This is definitely not common, especially because they're going to get cold, they're going to be heavy and hard to hold, but there may be appropriate situations where it's hard to extricate someone from the pool, and it's not appropriate to do that. This video is not going to capture every possible situation when it comes to spinal injury management. I don't have the capacity at this point in time to address land spinals, walking spinals, deep water spinals. Spinals are a huge topic and common in service or aquatic staff training because it is a big topic we want to continue to chip away at year after year, season after season. It's not something that we just master right away. I recognize in this video I did not have a lot of visual aids. This is mostly a talking head video, but I did really want to showcase some of the challenges I saw working with the team this weekend. They were wonderful, but a great example where it is something that we should always practice and be prepared to respond to, even though we hope it never happens. I am very passionate about this topic. I love what I do, and I'm so grateful that you've joined me to watch. If you enjoyed this video or if you found it helpful, please do leave me a comment. Do consider subscribing to our channel. This is definitely a passion project, and every single like or subscribe or follow makes a really, really big difference in terms of being able to demonstrate that there is a need for this content and find the time to allocate to creating more content. If there's any specific topics you're still looking for the National Lifeguard program or your own National Lifeguard preparation, please let me know in the comments below. This video may be slightly different from the techniques you have in your country or in your lifeguard program, your aquatic facility, but I hope you found some value in this video, and I will catch you in the next one. Thanks so much, and bye for now.